Welcome to another episode of Follow the Brand. I am your host, Grant McGaw, CEO of 5-Star BDM, a 5-star personal branding and business development company. I want to take you on a journey that takes another deep dive into the world of personal branding and business development using compelling personal stories, business conversations, and tips to improve your personal brand. By listening to the Follow the Brand podcast series, you will be able to differentiate yourself from the competition and allow you to build trust with prospective clients and employers. You never get a second chance to make a first impression. Make it one that will set you apart, build trust, and reflect who you are. Developing your 5-star personal brand is a great way to demonstrate your skills and knowledge. If you have any questions for me or my guests, please email me at grant.mcgaugh, spelled M-C-G-A-U-G-H, at 5-star BDM, B for brand, D for development, M for masters.com. Now let's begin with our next 5-star episode on Follow the Brand. Welcome to the Follow Brand Podcast, where we are building a 5-star brand that you can follow. I'm your host, Grant McGaugh, CEO of 5-Star BDM. And today, we're about to embark on yet another inspiring journey through the intricate and innovative world of brand stories. Our guest today is not just any brand story. It's one that has revolutionized fields, broken barriers, and changed paradigms. From the depths of cyber warfare in the U.S. Army to the groundbreaking labs of biomedicine, Dr. Tania Marie Martín-Mercado stands as a pillar of resilience, innovation, and intellect. Dr. Tania, a luminary in genomics and data science, brings to the table not just accolades and achievements, but a mission to bring about real change in healthcare. In today's conversation, we'll not only dive into the scientific feats and advancements she's pioneering, but we'll also touch upon the more profound implications of her work, such as health equity and the pressing need for diversity in clinical trials. Whether she's on the soccer field or in a high-tech lab, Dr. Tania is a beacon of passion and perseverance. We'll also venture into the future of healthcare, where we envision a world where tech giants and biomedical pioneers converge, and the consumer is empowered like never before. Prepare yourself for an enlightening exploration, and remember, you're tuned into the Follow Brand Podcast, where we are building a 5-star brand that you can follow. Welcome, everybody, to the Follow Brand Podcast. I am Grant McGaugh, and I get to get into an interesting topic today with my very, very special guest. We've heard a lot of talk about genomics. We heard a lot of it, especially during the COVID pandemic, and what that's all about, and that there's disparities in genomics of itself when it comes to creating drugs and creating, in the pharmacy world, and how that affects certain groupings of people, especially when we start getting into precision medicine, what that looks like. You understand these different drugs that work differently for different scopes of people, but what's really going on in that world. So I'm going to bring a subject matter expert to the mic, Dr. Tania. We're going to have a great conversation about this so we can move the needle forward. You'd like to introduce yourself, Dr. Tania?
Sure. My full name is Dr. Tania Marie Martín-Mercado, so we just focus on Dr. Tania to shorten that full sentence and keep it simple. I have my PhD in biomedical informatics, and I tend to focus and I get really passionate around genomics, particularly when we talk about genomics for precision health, genomics for community and population health, so on and so forth, and some of the disparities and differences that manifest themselves in the human body based on your heredity, your ethnicity, your environmental impact and stimulus that's coming from outside of your control, and how that impacts the way you ingest medicine, the way your body takes in that medicine and delivers it throughout your cells. So that's really my area of interest. Yeah, that's pretty much, I guess, right where I'm at right now. I don't want to get too far in the weeds of my past because it's all over the place. So yeah, that's where I am right now.
Now we're going to focus right in the sweet spot. I just read a recent article that you put out on your blog, and I was floored by it. I just was floored by it because this is good information, it's good intel. You wrote some things around with the FDA has put out certain criteria, certain information, certain findings around disparity in genomics and what the implications are. But it still it falls a little flat. I want to hear from your perspective. Now that came out maybe even a year ago or so. Talk to me about what you feel about that particular article, and has anything changed in that arena?
The second part of your question is easy. No. On April 13th, 2022, the FDA put out a draft. So it wasn't finalized when I wrote that article, a draft guidance on developing a plan to help enroll more participants from underrepresented and marginalized communities. And enrolling these participants into clinical trials. And it sounds very lofty. It sounds really great, doesn't it? That they're creating these plans in place. The problem is that the lack of diversity when it comes to clinical studies and clinical research really does impact how drugs are developed and how those drugs interact in people of different ancestral backgrounds. There are polymorphisms that contribute to a patient's genes. So one person that may be Caucasian may have a certain response to a drug that someone who is a Caribbean Hispanic, I'm going to say it because I'm Dominican, I can use myself, may have a different outcome, even though the drug is the same, the dosage is the same, the age, weight, blood pressure, all of these other vital signs may be the same, but the drug may manifest itself differently between these two demographics, just simply based on the differences in their genetic history and their genome. So when you look at that and we want to include diverse patients into clinical studies, this is why we want to make sure that we are accurately representing the populations that these drugs are developed for. And we can't do that without diverse participation in those studies, right? You can't create data from guesswork, right? You need to actually have evidence-backed data of these ancestral differences and of the way a drug manifests itself in the body. So that's the background of it and why the FDA has put these lofty goals in place as far as guidance. And really hear that it's guidance. It's not compulsory. It's like suggested, right? So there's no real accountability for drug manufacturers and organizations that run clinical studies. There's no real accountability to meeting those diverse participation goals. And by accountability, I mean financial. I mean delaying the drug being released to market. That's accountability, not like, oh, well, you tried. So, we want to get beyond that. And so my article discusses not only why diverse representation in clinical trials is extremely important for drug development, but it also discusses the lack of accountability when it comes to the pharma industry as a whole, when it comes to meeting the guidelines that they've set out, right? It's just performance. It's performance. So that's what my blog talks about.
That is so interesting. And it begs the question to find out, right, where does the true cause lie? Is it because some diverse populations just are adverse to clinical trials? They don't participate when there's a call for people to come in and to test and that type of thing. We're just adverse to that, and we're just not doing that. Or the pharmacy companies perhaps aren't making any concerted effort to try to enroll a diverse population to be a part of their study.
It's a combo meal of everything you just stated there. So if I take that, just roll that back a little bit, when it comes to certain populations being adverse to research, there are a number of historical, so many, actually, particularly among Black, and I am being very specific, African American, Black individuals in the United States, and some of the atrocities that have occurred in the past historically when it comes to clinical research and being used for research without permission, being put on display without permission. And then we have indigenous populations where their graves were dug up to try to prove white supremacist ideologies at using biological data. So they're, without permission, digging up graves and decapitating. There's a lot of history, right? I go on and on, but it's now, right? And so this is a personal opinion. This is a Dr. Tania opinion. I acknowledge the fact that these atrocities took place in our history, and it's not without a valid concern when you go and you sign up for research. Like, am I going to be targeted? What is all of this information about? And then the recollection, there's just distrust overall among marginalized communities of every ethnicity other than Caucasian. I'm going to be really blunt about that when it comes to the medical field and when it comes to clinical research. And it's often because we distrust that dialogue. We distrust, and just think about, we're all patients, right? So think about how you feel when you go into your doctor's office. Is that something that you proactively did? Do you feel comfortable in there? How comfortable do you feel talking about your personal life, the personal issues that you're having, particularly if there's a combination of mental and physical health and well-being? And so there's a discomfort right out of the gate. And I can say I even have that. I have zero personal relationship with my primary care provider. And so and it's the VA, right? I'm a 20-year veteran in the U.S. Army. I'm going to the VA and I'm still like, why are you asking that? Right? So I understand it, but we have to take into consideration that we need to become advocates for ourselves. And we cannot continue to stand behind this veil of fear and prevent ourselves from being accountable for our own care, for speaking up for ourselves, for understanding the implications of what we're eating, what we're consuming as far as content, where we're living. Having those types of input into our own care matters. And so when you are invited, or if you hear about a clinical study, and your initial response is, I don't believe, and this is another one, I don't believe, how are you not going to believe in it? It exists. It's there. So believe in science, believe in things that you can have a part of and be a part of, and stop hiding behind historical atrocities. Acknowledge that they exist, but that is what has allowed us to do better and have inclusion, exclusion criteria that make sense, have informed consent, and allow you, when you're going into a clinical study, to ask a number of questions. How does this interact with my current medication regimen? What is this drug actually targeting? What is the outcome? When will it be released? Ask questions, be involved. Don't just sit on your couch and think, I remember the Tuskegee experience, I'm not going to get involved. Get involved, right? And don't use that fear-based logic to paralyze you into being accountable for your own care and the care of your loved ones. So there's that. That is on the individual to take some self-accountability. When it comes to the clinical research community and researchers and people developing a research study and patient recruitment tactics and strategies, be intentional, right? So if you are working at an organization that is tasked with, and this could be a clinical research organization or the direct pharmaceutical company that is tasked with going out and trying to meet diverse criteria, who are you sending out to have these conversations? Do they look like me, or do they look like you? How comfortable are you making this community feel? Have you partnered with community-based organizations that already have a presence in these communities to establish some sort of trust? What are you doing that's intentional versus just putting out like a social media campaign or a radio campaign or a postal campaign? How are you actually targeting the community that you want to be a part of your initiative? And if you aren't being intentional, and if you aren't asking questions of people within that community, how they want to be spoken to and how they want to be reached, then you are deliberately missing the mark because it is 2023 and the means of communication are vast. So try harder. I don't want to see just, oh, well, we put out this campaign and people didn't respond to our survey. Well, what else did you do? Right. So that's kind of where my frustration comes in on both sides of that coin.
No, those are valid points all the way around. And I saw some things that even took place during the COVID time period. We were having conversations, but what were the actions that took place? And one of the things I suggested, we talked about like Stiggy and some other things that have happened. Like, have you, openly apologized for those things? And I'm talking about the industry as a whole. And very few. I found that I think the U.S. government one time said, something to that effect, that at least acknowledge the activity and literally apologize for it. Obviously, there was some compensations along those lines, but it was not great. But here we are. We can't afford not to understand what we need to do from a scientific standpoint. And the thing that I was referring to is, I think an apology would be great along those lines. But you have to talk to people as it is. Here's the science. Here's the situation. Here's what we need. We understand that different drugs affects different people. I think most people now are starting to understand that certain groups of people are prone to certain disease states than others.
Right.
So that should bode well. Like, all right, well, how was this drug developed, and where was it developed? And was it developed in the USA? Was it developed in other continents, like where there's a lot of groups, like you talk about, Africa or the Caribbean, or even other Asian populations? Where was this? Where was it tested? Where was it delivered? And then the why. So the why is so important, and I think in communities, if they understand why. Especially, let's take something like sickle cell. Sickle cell really only affects people of color, right? So who's developing those methodologies and medicines and all these different things for this population that truly needs the help? So communication and really getting the information out there about why this is so important. I think is so that I would like to see those type of campaigns come out, those kind of town halls come out. Like you said, let's get into more group discussions. So let's get past the past and first acknowledge it, but then get into the present by saying, here's why this is so important.
Right. And it's heartbreaking to witness individuals in such large quantities, their high mortality, high morbidity rates for conditions that were preventable, that could have been managed had they just known the information, right? Or had they just taken a little bit more accountability into that care and known to ask the right questions. And then we get into some very very real unfortunate situations where we can't control the number of Black and Hispanic physicians out there. The quantity is low, right? And so I don't know how to impact that. I don't know how to get more individuals of color from marginalized communities to take an interest in healthcare and become a doctor, because there's so many barriers along the way, right? And I don't mean intellectual. We got it in spades, right? What I'm talking about are the systemic obstacles that make it extremely difficult to be a person of color, much less a woman of color, and try to get into the medical field so that you can positively impact your community. So I understand that when we talk about public health, when we talk about genomics, we talk about certain conditions that impact communities of color, marginalized communities, indigenous communities, so on and so forth, the representation in there. And so it's really difficult to establish trust. And it's really difficult to get past some of those social atrocities when literally the people that contributed to those atrocities look like the person standing in front of you. Yeah. So I understand it becomes difficult, but I still think we have to take that step. We have to take that step in becoming more informed, understanding there's a number of genomic tests available that so many people aren't aware of. So many people of color aren't aware. They don't know what their insurance does or does not cover. The most common one is actually the it's called a BRC. I call it BRCA1, BRCA2 test for breast cancer. Most people, this is statistics, right? So statistically, Hispanics, Blacks, a little sprinkle of Asian Americans on occasion, but primarily Blacks and Hispanics do not take that test. And often, if you have insurance, it is covered. I believe that there's certain states that have covered it in a broader capacity to include CMS, so Medicare and Medicaid, if you're on public insurance. But you have to go and do it. And also you need to ask the question when you're in front, and let's say you have a family member that has had cancer in the past, asking that question proactively to say, does my insurance cover a biomarker test for cancer so that I can maybe change my habits, so that I can maybe change what I'm doing differently? Right. And so if you're a huge social drinker and you have a history of liver cancer in your family, maybe you want to know that so that you can make some different choices. Right. Right. So you just being aware and being accountable and knowing the questions to ask, knowing your own family history, and just knowing what isn't covered by your insurance and what you can and can't afford. Just asking the right questions has a lot to do with it. But again, I get back to when you're in those situations and you're in front of your primary care provider, which a lot of people of color do not have, by the way. Do you know what questions to ask? And so then that's another issue is, what about the huge number of individuals of all age ranges among marginalized and underrepresented communities that do not have a primary care provider? How many women of color do you know have never been to the gynecologist? Never. I know a lot, right? And they're not even aware of their own reproductive system. And it doesn't help that we have men making decisions about women's health, which is a completely different topic of conversation and I can go off on a tangent about, but it's you still have to know your own body. You still have to know like just the basics of how stuff works. No, there's no such thing as a normal menstrual cycle in a best practice. There's your normal, and your normal is specific to you. Same thing with men. How many men do you know past a certain age haven't gotten a prostate cancer test or just had their prostate checked? Or know to ask to have that done, right? Because maybe the primary care provider or the doctor that you're standing in front of won't volunteer that because they're not comfortable with you. They know you're not comfortable with them, and it just gets weird. They just want to make sure you can bill properly.
This episode is brought to you by 5-Star BDM. 5-Star BDM is a professional consulting and advisory group keenly focused on business development services for small to mid-sized businesses and entrepreneurs. Although every business is unique, they often share challenges that can be addressed through smart branding. Services include process improvement in operations, digital strategy and transformation, business intelligence, digital marketing, and personal branding. Our 5-Star business and personal branding company has helped a number of professionals and organizations to optimize and grow. The result is more business, more opportunities, better reach, positive outcomes. Please visit www.5starbdm.com to learn more and view all the episodes of Follow the Brand.
I just went off on a tangent. I'm sorry.
No. All these things are just important when it comes to health and then health care. Help us understand what you're doing now. You have your business, what you're doing on a day-to-day basis to help, to actually, grow awareness, to make a difference. Tell us a little bit more about your business.
Okay, sure. So I am focused on, and it's so limiting when I think about this, I'm thinking about everything I just said. There's two areas that I've really dug deep into. And one of them is lupus. It's considered a woman's disease, and it disproportionately affects women of color of childbearing years. So it's traditionally underfunded and understudied. The second area where I really take a look in is PTSD, because I am a veteran, and PTSD is a very personal experience. One version of PTSD for one veteran, and I am speaking to the veteran community, is very different than another. It depends on when you serve. Were you involved in any wars? In that war, were you involved in combat? What was your role? What was your experience in uniform? among the base or just interacting with your superiors. There's a lot of things that go into PTSD, but for both of those conditions, there's a biomarker that you can be tested for. Specifically for PTSD, it's a biomarker that is basically detecting suicidal ideation, right? And so, I'm sure we've all read about endorphins and all the happy endorphins and proteins and neurological conditions that contribute to depression. A deficiency in those areas is why people sometimes experience heavy mood swings or depressive states. That's actually, it's a chemical in your brain, right? And that can be measured. And there are levels to that chemical in your brain. Too much, you have kind of a manic situation. Too little, you have a depressive situation. And everyone's scale is kind of in the middle. Yeah. If you have taken into consideration in PTSD, which is always an external stimulus, and that external stimulus could be your own thoughts, right? Particularly the more intelligent you are, the more likely you are to come up with some really crazy things that you think could happen because you can logic your way through it, right? And then there's external stimulus, like I'm sure you've heard of people during the 4th of July. There's usually something that says, hey, there's going to be fireworks sounds and firecrackers that can trigger a PTSD response. Too many people in an enclosed location can trigger a PTSD response. You combine those external stimulus with that fluctuation in your brain chemistry, and you may be able, there's research that needs to be done, and so I'm being very careful here, you may be able to determine for one individual or a certain population of individuals that maybe experience the same type of PTSD symptoms, how can we personally treat them? How can we prevent an episode? Same thing with lupus. There's a biomarker for lupus, just to show that if you have a predisposition for it, it doesn't say if you have it, you just have a predisposition for it. Lupus is extremely hard to diagnose. It takes about 6 years to accurately diagnose it. And it's a combination of factors that you need to have in order for that diagnosis to actually be relevant. So it's not just one, I think it's 4. So 4 out of 12 that you need to consistently show. And people within the same family who both have a biomarker for lupus, one may develop it, one may not. Lupus is, you'll see a lupus flare manifest itself differently due to stress, sunlight exposure, and a number of different factors that are very individual. So if I know that I have a predisposition for something like lupus, maybe I can understand myself better. Number one, participate in those clinical studies that can measure these things, and also have a conversation with my primary care provider to say, you know what, I'm keeping a journal and I've noticed my skin starts to flare up a little bit when these things happen, and it's been consistent, right? And so you just have some of these areas where you can be more proactive in your care. And so for my purposes of research, I really do like to study, is there a biomarker for something? And within that biomarker, how can we move towards the genomic information to provide a more personalized treatment, a more personalized care plan based on a number of different variables? So let me know if that answers your question. I know it's a long
That is a lot to unpack, but I heard a lot of lupus, I heard a lot about PTSD. Would you consider yourself a physician? Are you a researcher?
No, I don't have the personality to be a physician because I'm really impatient. So I'm definitely on the research side. I like to focus on the prevention and the discovery and the why versus the reaction and that side of they kind of play nicely in the same sandbox, but I really do like to discover why someone gets sick and can it be prevented versus now they're sick, let's treat the condition. Definitely the research.
Yeah, you're very proactive, and then you see the cause and the effect. Let's try to look at the root cause of different things. I see you're big into biotechnology as well. You've done some work with Microsoft in the past. You've done some things with AI. You've seen some of the biases that are in artificial intelligence that are out there. And a lot of that just really depends on who's programming, where's the data sets, where are they coming from? But understanding these different things are very, very important. Talk to us about your research in that area and what some of your findings are when it comes to biotechnology.
Oh, that is such a green playing field. And I am not an expert. There's so much I still need to know and learn when it comes to that. So it, I like to combine the math with the biology, right? And that's basically biotech, right? Or the math with the technology that can automate certain process or automate an algorithm. So that's when you start getting into machine learning and predictive analytics. So if we can come up, this is just off the top of my head, if we can come up with an algorithm that properly inputs different variables and combines it with the data, the biological data from a biomarker, can we automate customized treatment plans in a way that can be built in a system, right? So those are the kind of things, and this is somewhat where we're going as we start getting into the consumerization of healthcare. We're going to start seeing people way smarter than me that have very strong mathematical minds to have what I would consider flexible math, right? And so then you have to start getting into weights. So is one variable weighted higher than another? And so that you try to have some sort of consistency. And also, can there be variance in the formula or in that algorithm that allow for nuances, right? And so you want to try to create code that can change on the fly based on the input that's being received. And that input could be biological, it could be environmental, it could be you name it, right? So in a very practical way, I have asthma. Thank you, U.S. Army. I have asthma. Okay, thank you. How it is that, and I play soccer religiously, I'm a big soccer player. How it is outside affects my performance on the field. It's not even the heat, right? It's if they have treated the grass with a chemical and I go out and play, I can feel that closing up. And it can be the same temperature. So last night I had a game, 8:30 p.m. here in Dallas, Texas. It's 99 degrees outside. It was fine.
Yeah.
Right, because the field was different. And I am comparing this to like a Sunday game that I had on a different field that I know is just treated. They just laid out the new grass. You can see the little squares that they laid out this new grass. And I was struggling. I'm like, and the temperature was the same. I'm still in the Dallas-Fort Worth area. The difference was the chemical on the field, right? So those are variables, right? What is the constant? I have asthma, and it's induced by my environment. I don't have the kind of asthma where I can just be sitting here and have an asthma attack. That's actually a different type. It's a chronic asthma. I don't have that. I have exercise-induced asthma. So my environment directly impacts whether or not I will have an asthma attack. What if we can mathematically program that? I can see the weather outside. I can see, at the bottom of your phone, you can see like the pollution levels.
Yeah.
So importing those types of variables in there and combining it with my diagnosis, the current prescriptions I'm on. I have a steroid inhaler. It's like a big old disc, and then I have my albuterol, my rescue inhaler. Combining that with what I'm currently taking on a regular basis, and give me a plan of action for the day. How many minutes should I play before I need to get subbed in, right? So, you know what I mean? So those are the kind of things when we talk about what I just said and kind of make it real. When we talk about environmental variables and how that impacts a person's condition, think about if you have diabetes, what you eat, what you drink impacts that condition in your body, and that may be different than someone else. Maybe how your body digests sugar is slightly different than the person over here. Maybe your diets are different right out of the gate, right? Maybe someone has access to organic food and someone has access to kind of the concentrate non-organic. And you can kind of see that in how the U.S. is the most unhealthy country.
Yeah.
Right?
Yeah. No, what you're talking about is so important. Well, it's very important. We're not there yet, but we're getting to a point. You're going to start seeing this, especially in the consumerization of healthcare. And you look at all the different factors of why this is so important. Because a lot of people, you said something earlier was so important. How many people actually see a doctor? And even the people that do see a doctor, if you only see a doctor once a year, typically that's what happens. You take a physical, you go in, you take it once a year, they check you out. And if nothing's wrong, you might not see him for another year. Right. So we're getting to a point now, because a lot can happen here as far as, if you do start getting some kind of a disease state or something like that, that you get into this constant monitoring mode. What can you actually do that without being intrusive, right? That you probably trust, right? So if you can get to, I don't know if I'm call it AI, it's just computerized models that use, because that's such a large amount of data that what you're really talking about is quantum computing, because it would have to take information from so many different variables. And like you said, the weighted measures what's important, but starting to give yourself, think about this. If you had this constant readout every day that from a trusted source, obviously, between you, like, hey, today's world, taking in all the variables of the temperature, everything that's going on, it starts to tell you, like, you know what, for today, in your metabolism, that you are very good at eating, carbs today, or you should be eating this or that. It starts giving you a whole playbook of information that's specific just to you, meaning it wouldn't really be applicable to someone else, but it's very applicable to you. So then again, if you started having some issues, and it probably would tell you, you should go check out a physician. And then you have that information to actually upload to a physician who actually can see what's going on historically, not just present state. And then you start to get to better diagnosis states. I think when we get to that level, that we can. It's going to take a little bit of time, but some intentionality to the whole thing, because the healthcare system as it is right now is not affordable. Because we're dealing with what you said earlier, you're dealing with people that are already sick. So if they're already sick, that's when they get into chronic care. That's the most expensive type of care. So from a payer perspective, obviously for yourself as well, you want to catch that disease state as early as possible and begin treatment, right?
Right. So what you're referring to, Grant, is we're actually not that far. We're not that far. So take, I do love Microsoft, okay? They got their ups and their downs, but man, I love that company. Take Xbox, right? Now, the new ones, you can create these really cool avatars of yourself. So imagine if we take that technology and create a digital twin of ourselves. Think about the amount of data that we're constantly giving for free to social media. I have my little Garmin on, and I'm constantly taking in readings. These are just ones and zeros. These are data variables, right? These are data points. And if I had an avatar of myself in sort of kind of a gaming-like environment, well, now we have the ability to take that. It's not that we don't have the ability to do quantum computing. We've had it for a minute. And it's not like we don't have the technology in place to capture these different data points. We've had that for a minute. It's like Legos. We need to build it, but the individual pieces are there. So if I had a digital twin of myself, and I could take in all of these data points before I even leave the house, I can see, right? And just imagine that being on my screen. Like, you got a little Xbox controller, like, okay, how's my day gonna go? What's going on? Right? You know what I mean? And so, but it's a digital twin. I can interact with people, and then it's in my house, so I don't have to worry about my primary care provider, right? I don't have to worry about that certain level of discomfort, because I really don't want to talk. And I'm also an introvert, so I don't want to talk to you anyway. So if I'm in front of my primary care provider, I'm now more comfortable because they already have the information. I don't have to repeat myself. They may want to validate some of the data points, but they've already got so much information. I'm now more comfortable having a conversation that's not starting from the very beginning. Are you on your period? Are you pregnant? No. Can we focus on the fact that
it's too personal. I don't know.
And I got a game in 2 hours, right? So, these are the kinds of things when we talk about how can we address multiple issues, particularly when it comes to trust and presence and representation in the community. I don't think we can fix that as fast as we can innovate. So we can innovate and create a digital twin of ourselves that can take in all these healthcare data points. And now we have an opportunity to have predictive modeling. And of course, you want something that will learn And we know that technology is in place. Have you used Netflix? Have you used Amazon? It's learning all the time and listening and thinking. I shouldn't say that. Somebody's going to be like, oh my God, Terminator. No, okay, so it's not thinking, but it's basically taking in all these different data points and coming up with suggestions based on your history. And your history could have been 2 minutes ago. So my point is that the technology exists. And I think it's easier to combat several of the issues that we've covered today when it comes to lack of trust in the community, lack of representation, lack. When we talk about the consumerization of healthcare and bringing it into an applicable situation in your home, well, we're gaming. Just look what's successful. Gaming. So we have the HoloLens, we have extended reality, we have all this technology available. And if we just changed our thought process and used it for healthcare and used it for research, well, then we just addressed everything you just said. So just an idea. Those are, when you ask about the things that I work on, things that I look at. So it starts with what's going on in the human body as it is, and then how can we make it so that it's more accessible? This information is accessible to communities and populations that don't have access to it or are uncomfortable.
This is so important. I like the fact you say, hey, Grant, it's not that far away. This is not, this is 2023. We are in the future.
Yes.
So the technology is available, but it has to be intentionalized for a purpose, and that we can get good, constant readouts of our health. Just like in the car, when you jump in your car, you're constantly getting the readout, looking at the gauges of its current state. If it needed gas, or if it needed oil, if there's something going wrong, a check engine light might come on and say, hey, you need to go take it in to take it to somebody. Well, what are we doing there for our body? So I think that's something we can certainly do.
Yes.
And we're getting there, like with the wearables and things of that nature, but, taking it to an even higher level. I like what you just said there. This has been wonderful. Before I leave, I want to make sure that you have an opportunity to address my audience directly of anything that we have not talked about that you really, truly feel is, first of all, it's super, super important. And it's just something you need to take into account as we go forward. What would you say?
Just one thing? Can I have?
You can have as much as you want.
Okay. So the first thing I would say to the audience is, if you do not have a primary care provider, find one, right? And if you are uninsured or underinsured, do what you can to try to get on public health care. And I know that's a lift in some cases, but take that first step. The second thing is that I would say is ask questions. And I don't mean Google your condition and hit your doctor up with some random thing that you've heard on YouTube. That's not what I mean. What I do mean is take factual information about your health and well-being and be able to present that in a way that you can advocate for yourself, either in front of a doctor or any other public health professional, right? Or clinical professional. And be careful. Trust but verify. It's a military term, but trust but verify. If your best friend Pookie is telling you not to get the flu vaccine this year because he heard that it was made out of eggs that were genetically engineered with pig DNA, and I'm making all this up, but this is the kind of ridiculousness that you hear. Maybe fact check. I'm saying maybe fact check that, and don't bring that information to your physician because they're going to look at you crazy because it doesn't make any sense. So make sure you are getting factual information. Trust but verify that information. Google is your friend and it is free. And you can differentiate between reputable sites that have healthcare information versus trash. So those are the two things I would say is just really be accountable for you have people, if you're listening to this, I'm pretty sure you have people in your life that love you, that want to see you around. So take a step and be accountable for your own care. That's what I would say.
Those are very good tips. I want people to take that to heart. And if it resonates with yourself, make sure it resonates with other people in your circle so it resonates in our community so we can all get healthier, better. Dr. Tania, this has been wonderful. You've got to let people know. And I've seen your website. Tell people where they can get in touch with you.
Oh, okay. drtaniam.com. It's very, very simple website. I don't know if you add text to your podcast, but I'm happy to put a link in there. And if you have questions, if you're uncomfortable, I may not know the answer. I will find you the information. If you have a condition and you're curious about a clinical trial, I will advocate. I will find something for you or tell you there's not one in place. I'll give you, if you are interested in your care, interested in clinical research, I will try to point you in the right direction as best I can. But don't email me with foolishness. Don't even do it.
Oh, no, she is not. She is a very serious person. This has been wonderful. Thank you so much for being on the show. Let all of your listeners in your network know. They can come to www.firestarbdm, that is B for brand, D for development, and for masters.com. We have hundreds of people that have shared their stories, just like you, Dr. Tania. We are growing in awareness. We are getting stronger. We're getting better. We are getting smarter in everything that we're doing along a lot of different lines. And I so thank you for sharing your story with us today.